Now that school is back in session, the current question many parents now have is if it is safe for their kids to return to in-person learning. The majority of schools in New Jersey have returned to in-person learning. It has been shown that transmission and infection rates are highly dependent on the precautions taken by the school. In order to ensure kids have enough protection when returning to school, the CDC has recommended universal indoor masking. The appropriate mask is a non-valved, multi-layer cloth mask. It is the most effective at blocking the release of exhaled respiratory particles into the environment. Parents should ensure that their child is wearing the mask properly. It should cover the sides, should not be below the chin or the nose, and should not be touched. In order to keep children safe in school, it is important to maintain at least 3 feet of distance between students in the classroom. Parents and schools should promote good hand-washing techniques, such as hand-washing to the tune of Happy Birthday to make it fun for the children. Make sure you wash your hands with soap and water and by rubbing palm to palm, in between fingers, back of hands, base of thumbs, back of fingers, fingernails, and wrist. It is important to always wash our hands after using the toilet, after sneezing or coughing, after playing with pets, after sports or playing outdoors, and before eating. Reduction of sport participation has touched millions of students throughout the country. Sports have played a vital role in many aspects of students' lives and career, and its absence greatly affects students' physical conditioning, emotional stress management, and opportunities for college scholarships. It is important as we move forward in this new normal for patients to create a healthy relationship with sports, to be patient as New Jersey incorporates social distancing and COVID safety precautions into school sports as the school year progresses. During gym class, it is important to continue to wear your mask despite how uncomfortable it may be. Children that do get infected can get sick and spread COVID to others. During the spread of the Delta variant, COVID-19 hospitalizations among children and adolescents increased 5-fold. Now, the CDC is recommending the Pfizer vaccine for all children 5 to 17 years old after emergency FDA authorization. The vaccine is completely safe and 90.7% effective in preventing symptomatic COVID. There is a specific pediatric Pfizer vaccine for children ages 5 through 11, and the adult vaccine is recommended for children 12 years old and up. Here are some facts about the COVID-19 vaccine for kids. Children will receive 1/3 of the dose adults and adolescents are given. Children will be given the vaccine using a smaller needle. Children cannot get COVID-19 from the vaccine. 2 doses of the vaccine will be required. Your child can get the COVID-19 vaccine and other vaccines at the same doctor's visit without waiting 14 days between vaccines. After getting the first dose, your child must wait 3 weeks before getting the second dose. Things to expect after the vaccine include the same side effects you may have felt after yours. Your child may experience pain, redness, and swelling on the arm where they got the shot. They may also feel tiredness, headache, muscle pain, chills, fever, and nausea. Consult your child's pediatrician for non-aspirin pain relievers or other remedies you can use to comfort your child. There have been reports of myocarditis and inflammation of the heart muscle post-vaccination in children. In the clinical trials studying the vaccine in kids 12 to 17 years old, a small number of adolescents and young adults experienced mild cases of myocarditis after getting the COVID-19 vaccine. Most got better on their own or with minimal treatment and rest. And in the clinical trials of children ages 5 to 11, there were no reports of myocarditis from the vaccine. In fact, there is a greater risk of myocarditis in children from COVID-19 infection compared to COVID-19 vaccination. Vaccinations are a tried and proven public health strategy through which we can end this pandemic and safely return to in-person schooling. Vaccinations, coupled with continuing preventative precautions such as wearing masks and washing hands, will provide a safe and healthy learning environment for our children.